Okay, so Bismillah, alhamdulillah, wa salatu wa salam ala rasulullah ba'd. Assalamu alaikum wa rahmatullahi wa barakatuh, my dear brothers in Islam. I'm going to ask Shaykh Hussam, inshallah, to start us off with the opening dua. Then I will address you with quick tips, inshallah, for what to do, what not to do, dealing with the current issue, especially when coming to the masajid. Then we'll give the floor to Ustad Ahmed Salim to be able to let you know the logistics. And finally, we'll go to our chair for the board, Brother Shihab Ka'b, to also let you know what the official stand with the ISNA organization, and I'll bring it back to finish off with the positive spin, inshallah, with our Sheikh Hassan reminding us of the ayat and ahadith, the Quran and Sunnah, of how to deal with these issues when it comes to also the history and how to deal with it in this present time, inshallah. So with that, I ask Sheikh Hassan to start us off with the opening dua, inshallah. Please, bismillah.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم يا أيها الذين آمنوا أطيعوا الله ورسوله ولا تولوا عنه وأنتم تسمعون ولا تكونوا كالذين قالوا سمعنا وهم لا يسمعون.
Okay, Bismillah, alhamdulillah, wa salatu wa salam ala rasulullah ba'd. Inshallah, we'll go through quick tips. Trying to keep this as many as possible. So there are a few mini lists that we received that we're gonna share with you, inshallah. So first thing is the obvious. I know that 1980 we were thinking that 2020 will be, going through the moon, doing all this new stuff and flying cars. But now we're back to 2020, teaching you how to wash your hands. Amazing, yani. So first thing is, please, the obvious is just through the contact. Where nobody's a doctor here, but here's what we heard. Please wash your hands with soap. Believe it or not, actually, I'm just heard it's actually more effective than Purell and so on. Another thing that we can do is make sure that we're concerned about your elder, not yourself. So when you come here, please also understand that you may be a carrier and not know it. And if you go back home and give it to your mother or your father, may Allah protect them all from that, protect us all from that. Just keep that, inshallah, in mind. So if you have any symptoms that you can, you notice that there's something different, please stay home. Allah will reward you that 27 multiples, the reward, with the intention, inshallah. Also, if you are coming from home, the sunnah is to make wudu in at home. So we're trying to ask you, not we're not gonna trying to save on the water bill, wallahi. We're just trying to make sure that you minimize the touching the surface and spreading the virus as much as possible. So you can make wudu at home and you can come here and pray the obligations. Also, the sunnah is to pray the sunnah at home, believe it or not. So minimize the time that you're going to be here when it comes to the crowd, inshallah. Speaking of that, from home, please bring your own musalla, bring your own prayer mat. So it also minimizes you touching somebody else's hand and so on. Please, specifically when you place your face and nose and so on, your eyes are close to contact to the floor or the carpet that people have been also touching. Minimize your travel, and if you have been traveling, please also stay away and do your self quarantine for 14 days and so on. So if you have any issues or concerns, don't call us. We can't help you. Call a doctor, inshallah. And also, no more shaking hands. And even this pains me because I'm a very touchy, lovey, kissy, huggy person. Goes against everything I believe in. But putting away the harm has precedence over bringing the benefit. And the good of all precedes the good of one. So from now on, we're gonna do this either Queen's thingy or Wakanda Forever or Tika Acha, GG, or the foot thingy, whatever it is. As long as we don't touch as much as possible. That's just a summary of how to do things. Please make sure that you do your best. Of course, the du'as and all of that things that Sheikh Hussam will cover. From that, I ask Ustad Ahmed Salim, inshallah, to address the logistics. Then we will take it again to Brother Shahab and finish with Sheikh Hussam. Jazakallah khair.
Sure. Assalamu alaikum wa rahmatullahi wa barakatuh, everyone. Thank you for joining in. Jazakallah khair. You took a lot of my points,
I'm
but
sorry,
it's all
yeah.
right. The point is that we want to benefit people. So how is it impacting us when it comes to our two centers, Jami Masjid and ICC, or Islamic Center, or as it's known at ISNA and Mississauga? So first and foremost, you'll find that a lot of our salawat are going to be very short. So the imams are going to be instructed that they're going to lead very, very small salawat. So, the surahs they're going to select are going to be short. Similarly, our khutbah starting tomorrow is also going to be impacted. So we're trying to wrap up everything within 10 minutes. So the khutbah happens and then salah and everything, so that, you're in and you're out, so that we minimize the congregation within the masjid. All other activities that we usually would have in our lobby, anything that could become a hazard for people coming in, coming out. Lastly, we've already started putting a lot of hand sanitizers. So we're going to be guiding people, ushering people as they're coming in for Jumu'ah tomorrow to go to the hand sanitizers, wash their hands if they are coming in. As Sheikh said, make sure you come with your wudu from outside so you don't have to go through the bathroom to make wudu or those areas. But in any case, there's going to be precautions in place for us tomorrow, specifically for Jumu'ah. We are going to be carrying on with the Jumu'ah, inshallah, as it is pretty evident from what I'm saying right now. And lastly, keep monitoring our social media, because this is an ongoing thing. So as it develops, and it can formulate into other things. So if we're going to have any formal announcements or anything, we will be doing that. I think Shihab is going to tap a little bit more into what the information he has from medical professionals and how it's going to impact some of our programming. But I'll pass it on to him for him to actually lead on to that.
So I just want to put things in perspective. Like, this may sound a little bit as drastic changes that we're making by stopping the programs and just focusing on the main prayers, but I think this is very important because we have been consulting with a lot of physicians, those that are specialized in infectious diseases, and they have been actually advising us to make sure that we do not help spread this virus. Alhamdulillah, we've been blessed in the last few months where our centers have been really booming with a lot of activities, but that's a risk right now for our community, especially the elderly. So we've been monitoring what's happening with the public health. We've been also monitoring what the other countries have been doing, whether it's the UK or the US or other leading Muslim countries. And alhamdulillah, in Canada, we have not at this level of high risk than the other countries, but we want to be taking proactive actions. So that's the reason why we're making all those changes. We're going to continue having discussions with those experts and then getting advice from them. And as things progresses, we will keep you updated. That's why it's important to stay in touch with us through social media, so that you hear what's happening and you hear from us what are the changes that were happening. But we ask Allah, inshallah, to continue to protect us and protect our community and help us to take the right action so that we keep everybody safe, inshallah. And I'll pass it on to Sheikh Hussam. Maybe tell us about how could we take this going forward.
Tamam. So Bismillah, alhamdulillah, wassalatu wassalamu ala rasulillah wa ala alihi wa sahbihi man wala. Feel free, if you have questions, inshallah, to send those questions. We'll have a little bit of time at the end to address some of those questions, bidnillah ta'ala. And we are monitoring your comments, so bidnillah, if you have any comments or any questions, please do add them. On YouTube, on Facebook, so wherever you're seeing this live, please add your comments, inshallah. The first thing that we need to remember is Allah subhanahu wa ta'ala can test by giving, and Allah subhanahu wa ta'ala can test by afflicting, and Allah subhanahu wa ta'ala can test by taking. So we see this, inshallah, as a test, and Allah subhanahu wa ta'ala can test individuals, can test communities in many different ways. But tests, they will depend on the outcome. So inshallah, this is a successful test for all of us if we're able to endure patiently and we're able to reflect and use this as an opportunity to think about shortcomings that we have and think about ways, inshallah, that we can emerge from this in a positive manner, bi'idhnillah ta'ala. Remember that Allah subhanahu wa ta'ala says in the Quran, وَلَنَبْلُوَنَّكُمْ حَتَّى نَعْلَمَ الْمُجَاهِدِينَ مِنْكُمْ وَالصَّابِرِينَ وَنَبْلُوَ أَخْبَارَكُم. We will test you until we know which one of you and which ones of you are able to exert patience, exert that struggle, take the extra step, inshallah, and until we know, and Allah subhanahu wa ta'ala knows but allows that to be manifested, until we know which of you is the most able to endure and is the most patient. And Allah subhanahu wa ta'ala says, وَلَنَبْلُوَنَّكُمْ بِشَيْءٍ مِنَ الْخَوْفِ وَالْجُوعِ وَنَقْصٍ مِنَ الْأَمْوَالِ وَالْأَنفُسِ وَالثَّمَرَاتِ وَبَشِّرِ الصَّابِرِينَ. So good news to those who are patient with all that happens. And who are they? الَّذِينَ إِذَا أَصَابَتْهُمْ مُصِيبَةٌ قَالُوا إِنَّا لِلَّهِ وَإِنَّا إِلَيْهِ رَاجِعُونَ. So remember, at the end of this and at the beginning, we remember that we are from Allah subhanahu wa ta'ala, and to Allah subhanahu wa ta'ala we are all returning, inshallah. So remember some of the hadith the Prophet Muhammad sallallahu alaihi wasallam used to tell us to say when we see these things and encounter these things. أعوذ بكلمات الله التامات من شر ما خلق. And he also used to say, اللهم إني أسألك العفو والعافية في الدنيا والآخرة. So we'll leave some of these du'as, inshallah, for you to read in the comment section, and some more documents for you to read more information on, بإذن الله تعالى. Another du'a to make that is very important, بسم الله الذي لا يضر مع اسمه شيء في الأرض ولا في السماء وهو السميع العليم. In the name of Allah, the one whose name, one invoked, will not have, or no harm will happen, inshallah, through the mention of his name, and he's the one who's always hearing, he's the one who's always knowledgeable. And then remember to do the hadith of the Prophet ﷺ, and this is the most applicable and the most relevant here. Allahumma inni a'udhu bika min al-barasi wal-junun wal-judham wa min sayyi'il asqam. So, O Allah, I take refuge in you from leprosy, madness, any form of epilepsy, and then evil diseases of any kind, inshallah. So remember, we're going to leave you with a list of ahadith, a list of du'as, and a list of, inshallah, a document that will go through the history of diseases in the Muslim community, and the history of pandemics that really affected the Muslim community throughout their history, inshallah. So that for you to read on your own time. But remember, Mu'adh ibn Jabal, Al-Fadl ibn Abbas, Khalid ibn Walid, Bilal ibn Rabah, and Abu Aswad al-Du'ali, so some very important names from Islamic history, have encountered pandemics like this before, ta'un like this before, and we have an important rich tradition and legacy of how to deal with this, inshallah, that we'll be sharing with you, inshallah, in the form of a PDF document for you to read later in the comment section, bi'idhnillah ta'ala.
Jazakallah khair. There are actually a few questions that are coming up. Some of them are related to whether the programs are going to be done online or not. So
I can shed some light on that.
Yeah.
So some of our regular programming, we are intending that, if it was a continuous programming, if people were coming and regularly attending, then the shuyukh are going to have their technology set up, and we were not doing this, and so we're going to set up the technology, and some of that based on the attendees' preferences will carry on online. We are actually looking into alternative programming, because I think we had a very bustling community in the last 2-3 months, thanks to Sheikh Hussam, Brother Shihab and Sheikh Ala at the back, that we don't want to end this. So you are still connected to our center. It's still your center, but it's now virtual, right? So we're going to be serving you online. You have like 54 people looking at this right now. That's more than what we get in our Maghrib halaqa, right? Like, Maghrib salah at this time, because of the time change. So I think stay tuned. A lot of these updates are going to come. Some of the questions that came up, and I want to pose this to you, Sheikh. So there was a question, they said that, can we do Jumu'ah online?
Okay, so Bismillah, Alhamdulillah, nice try. Thanks for playing. Sure, we can. No, I'm sorry. I don't mean to make be just about it, but realistically, we can't. The simple fact is that the scholars will tell you that Jumu'ah has to be established in the Masjid, and the Masjid is actually a place where it's established for the 5 prayers, not on Musalla and so on, and also there's a ha'il, right? There's also the connections of the lines, where it cannot be just having this, otherwise we will just do Hajj and everything else, do the thingy, and you know where I'm going with that. So just to answer your question, unfortunately we can't. But again, the scholars say it is permissible for you not to perform Jum'ah for the reason of khawf, and the scholars allowed, they say the 3 khawfs are loss of life, or fear of illness, or loss of family or health. So inshallah, that is what's permissible, so it's your call, but of course it's between you and Allah. You have to be honest with your intention. And so we're not there yet, brothers and sisters. So again, we're not panicking, but we're being proactive and taking precautions for your safety. And you are our target audience. It's our responsibility to make sure that you're safe. We don't want you to be pose any harm upon you, especially before Ramadan, because we want you to come and donate. I mean, did I say that out loud? No, just. I love you all. Inshallah, hopefully that answers your questions, and we'll see you soon. Inshallah.
Okay.
I'll get. There were maybe 2 or 3 questions. One of them is, I believe, about the medical professionals. If we had any people that we consulted with, actually, all the people consulted with were medical professionals. Alhamdulillah, may Allah bless them. They have been very proactive in connecting with us and giving us advice. So that's what we use in. We've done a lot of shura as well before we came with those decisions. So this was not an easy thing for us to do. We've been having meetings all along in this week. And then today we've made this major decisions in trying to move forward. And I think I hear some of you also asking, is there going to be a 3rd Jumu'ah? So for now, we're going to monitor. We are going to shorten the Jumu'ah for now. We're going to see tomorrow how it is, depending on how many people are going to come. Because we are advising, if you are sick or if you are older, please avoid coming, because the risk is much higher in this case. If needed, we will consider this option. And I would say any other ideas you do have, please send us your suggestions either to ISNA Listens or through our Facebook as well, so we can continue getting your suggestions and implement them, inshallah.
And just finally, a remark just to finish off quickly. Remember, inshallah, we are cancelling all of the halaqat at ISNA. So anything that is non-obligatory will not be conducted. So that means Quran journey, that means the Quran classes that we have, that means the halaqat usually after Fajr, after Maghrib, after Isha. So there will be no non-obligatory functions in the Masjid. And all of those, inshallah, we're going to be slowly, in the meantime, until we, inshallah, are able to reach a point of clarity, we're going to be conducting that, inshallah, online. So we're going to be doing those classes, inshallah, virtually, bi'idhnillah ta'ala. I know that there are a lot of recommendations and people here talking about shutting the masjid down completely for Jumu'ah. However, after consulting many medical professionals, we are now in a position where we are encouraging people who are at high risk. Please look at yourself, inshallah, and see if you're high risk. Don't come to the masjid. It's just not just for your own good, but also for the sake of others as well. So don't come to the masjid if you're high risk. Avoid contact, and we're going to take, inshallah, extra precautions within the masjid to ensure that we're delivering the Jumu'ah in the most effective and in the safest way possible. We'll be addressing that, inshallah, at the crowd. Tamam? And if anything escalates, we're going to keep you in the loop, inshallah, and we will come if, inshallah, and hopefully it doesn't come to it, but if it comes to a point where we are advised by our medical, inshallah, experts to shut the masjid down for Jumu'ah, we will go ahead, inshallah, with that, bi'idhnillah ta'ala.
Sheikh, so I think I want you to shed light on this one. This is, so somebody is 55 or above, and they are suffering with some, like, some chronic disease, and they're not feeling well, or like, at what point do they, like, because the question is, like, when does an old person decide who are the most prone that it's okay, and are they going to be sinful if they miss their Jummah?
Right. So good question. Jazakumullah khairan. Again, Allah subhanahu wa ta'ala says, يُرِيدُ اللَّهُ بِكُمُ الْيُسْرَ وَلَا يُرِيدُ بِكُمُ الْعُسْرَ. Prophet says, يَسِّرُوا وَلَا تُعَسِّرُوا, and so on. There are so many ayat and so many hadith that says in the meaning of the interpretation, Allah subhanahu wa ta'ala wants to make it easy for you, not difficult. And Prophet says, make it easy upon them and don't make it difficult. So al-mutatawwi' amir nafsi. Anything that you're voluntarily doing, you become your own amir. That becomes your own call. So you have to, as I said earlier, you have to be honest with yourself. If you feel that, ghalib al-dhann, for example, the scholar says we cannot shut down, the example that Sheikh was talking about, we cannot shut down the masajid or the fara'id, like the 5 obligatory prayers or the Jum'ah, unless al-amir, or the position of power, or anyone that is in charge, an authority figure, to say, you know what, this pandemic is an actual fact, not hearsay, and it's actually here, not coming, and so on.
Example of Italy.
What's that?
Italy.
Yeah, exactly.
Give an example, Italy, like how the
right on.
shut down,
So
the
right on.
government shut down.
Exactly. We're not there yet, so we cannot actually with clear conscience toward our obligations to Allah subhanahu wa ta'ala say shut it down. We're not there yet. That's the fatwa that came from the Dar al-Iftan, al-ulama, and so on. So till we get there,
Inshallah, hopefully it doesn't get to that level.
I
But
mean,
if it does,
we will address it accordingly. We're doing our best to make sure that you're safe. And again, wallahi, I was walking in the corridors today, and Brother Shahab was telling me, where is your smile? And it is true. I mean, I wasn't smiling, and usually, alhamdulillah, we're happy to serve you. We're happy to be in the house of Allah, because that's what we're here for. And I said, because I'm lost. Like, what's the purpose of living? What are we doing here? You know what I mean? Something is taken away from you. Your heart, something hollow. That is, it just feels, this is weird. Like, you hear about it, but when you go through it yourself, it's very difficult to take. So I ask Allah, like Shaykh Hussam says, to make this easy for everybody, protect everyone, and bring us back again together in the house of Allah always, as soon as possible. It's safe and sound again. Maqasid al-Sharia are 5, brothers and sisters. The purpose and the goal of the Sharia are 5. Hifz al-Din wa nafs is right on for 1 and 2, is protecting one's religion, protecting one's life, right? So this is right there. So please understand that we're doing this for you don't need to go to the 3, but that's the reason we're doing it, inshallah, and hopefully that will be a lesson for all. Maybe this could be the best thing that ever happened to you. You find God real quick, don't you? You know what? I better clear up my conscience. I better pay up my debts. I better, come back to pray. Better to start wearing the hijab. And I don't want to start this wallahi to be a sermon, but it's a point that we have to, as the Sheikh said, the ayat and the hadith. عسى أن تكرهوا شيئا وخير لكم. Maybe this is something you think it's bad, but it's actually good. ربما يفتح الله لك باب العمل ويغلق عليك باب القلوب ويفتليك بذنب تلتوب فيكون سبب الوصول. Allah will open the gates, but you know what? You're not there yet. Sincerity is not there, so it plagues you with something to wakes you up, so it will be a reason for you to reach Jannah, inshallah. Allahu a'lam. Jazakumullah khair.
Ahmed, there's a question about the cleanliness of the center. What is happening right now to ensure the proper cleaning and everything?
Okay. So I think at the very moment, what we're doing is our cleanly, like our staff, the caretaking staff, they've already been advised. So any areas of high contact, physical contact, they are disinfecting them. They're going down the hall, the handles, the door handles, the entrance handles, because those are the areas that are very prone to spread. Mind you, that the medical professionals are talking about this. I'm no medical profession, but like by speaking to enough of them, they said that it's generally happening with a contact, like a physical contact, or somebody contacted a door handle or something, and then 2 hours later, or 10-15 minutes later, somebody else touched on it and then it passed on. So we're doing that. Number two, we've as I mentioned earlier, there's hand sanitizers all across the place. Number three, we have already looked into options. We're not there yet, but like if it comes down that we have to change our HVAC filters, we're already looking at options and seeing supplies of saying that we should change all of our HVAC filters, because the disease is not airborne, but if it happens to be, and there is some evidence of that, then we should be prepared for that. So, and then there are other plans, but those plans are not at this very moment required, because we're not at that stage. But Allah knows what happens tomorrow.
And also, for each and every individual specifically, consult a medical expert and assess your own risk. If you are in medium to high risk, it is our recommendation that you do stay at home, even if it's a high risk for you and it's Jumu'ah, we recommend that you stay at home. And if it's medium risk and it's non-necessary events of the masjid, we do recommend inshallah that you stay at home.
And the
And
person
also-
prays Jumu'ah. Instead of Jumu'ah, prays Salah.
praise
Zuhr.
dhuhr at home,
Yes.
inshallah. And inshallah ta'ala, also, we're going to have, inshallah, more protocol when it comes to other events of the masjid, like nikahs and other things, inshallah. So stay tuned specifically for that. We will be reaching out specifically, inshallah, to individuals who have booked the masjid, bi'idhnillah ta'ala.
There was one question, one comment about the fact that people that are infected, they don't have symptoms, and so it takes time. So what's the risk with that? In fact, this is the reason why we're taking those decisions right now, and we're limiting all the activities in the center just to the fara'id. Because of what you just said, we know that there are people will have the virus but don't have the symptoms, and so we wouldn't know. So for now, that's why all the programs are cancelled. The only thing that we're leaving right now are the 5-day prayers and then the Jumu'ah prayer, and even with those, we're shortening the time so that there isn't a lot of time for people to have that contact. Plus, what Sheikh Ali was talking about, like we've already been talking to the community for the whole week about limiting the contact, so shaking hands or hugging, all of those things we're stopping
Culture
them
change.
to avoid spreading the virus.
Can you give a brief summary again of the things that we did just quickly?
Sure. Okay. So again, the things we do and don't do, again, is make sure that you use common sense prevails, inshallah. So washing your hands frequently with the soap. Some of them say at least for 20 seconds, but who has time for that?
No, we
And
don't.
yeah,
We
we
should
all
all
do now.
make time out for that now.
We all do that now. Please just stay away from all the surfaces and so on. For make sure that you're. It's also now they say it's airborne, so please make sure you stay away from crowded places as much as possible. Hence what we're doing right now. Also bring your own prayer mat from home, so you're not touching any place where somebody else is prostrated, especially when your face is going to be touching that. Make sure that if you have any symptoms, that you see a doctor. Don't call us. We'll call you. And if you also are establishing the sunnah, please make your wudu at home and do your sunnah at home. Make sure, if again, cut down on travel, and if you have been traveling, please make sure that you also could do your self quarantine for 14 days or so to make sure that you don't come and bring all these lovely gifts from abroad to us. We thank you in advance, but we thank you. Also, as we mentioned, do the foot shake as opposed to the handshake. I like the Sudani ones, that they go like this and Tika Acha, Gigi, all that stuff, or as we said, Wakanda forever, or whatever you wanted. It's all good. Just make sure that you also understand if you have any symptoms, please go see a doctor right away. As we reminded you, the good of all precedes the good of one, and pushing away the harm has precedence over the bringing the benefit, and you will get the same reward, inshallah, with the intention. And also, intention is la darar wa la darar. So it says you don't harm, don't get harmed, and don't reciprocate harm. Don't harm others. So with that, inshallah, I ask Allah subhanahu wa ta'ala to protect us all and give us a long, healthy, righteous life, and protect you, your family, health, and wealth. And I ask Allah subhanahu wa ta'ala to gather us very soon again so we can hug and kiss, as I do miss it, because they tell you that you need 8 hugs a day, and you need the vitamin H, you know what I mean? Okay, so from afar, inshallah.
Inshallah. Just to recap, so those of you that have joined in later, to recap, and we'll end with this. So some of the steps we've taken is the salahs have been shortened. The khutbahs are going to be super short. This will not be the norm after the virus is gone, so don't get used to this and don't request it. This is accentuated circumstances, and we need to do this. One more other thing that we said is make sure that the Sheikh mentioned we'll do from home. This is going to limit your contact within the center. And then as soon as you're done your salahs, your fara'id, your obligations, please head out. And I think this is a very, very good reminder for all of us, and we'll end with this, which is that Allah subhanahu wa ta'ala reminds us how quickly He's in control of us. Like we had all plans, and Ali radiallahu anhu, he mentions, and I'll end with this, he says that, I recognized Allah subhanahu wa ta'ala by every single plan of mine that flopped. And like we had plans upon plans, and our March was supposed to be one of the greatest month that we were going to achieve at ISNA, and here it goes. Like even yesterday we were all celebrating, and then Allah has His own plans. So we ask Allah subhanahu wa ta'ala that He never tests us, and asks us that we become victorious in this. And then again, all other cancellations will come, but in general, all non-essential programming at ISNA, in Mississauga and Jame, is going to be cancelled. All non-essential except fard salahs. Everything else is going to be cancelled, and there are alternative. If you're in a specific program, you will hear about alternatives of how you can connect, inshallah. Thank you so much. Dua, Sheikh.
Jazakumullah khair for tuning in. May Allah reward you and bless you and give you Jannat Firdaus, Ya Rabb. Ameen. I ask Allah subhanahu wa ta'ala to allow this to be an opportunity for us to reflect. I ask Allah subhanahu wa ta'ala to allow this to be an opportunity for us to connect within our own humanity and with Allah subhanahu wa ta'ala directly. And remember that difficult moments may perhaps be some of the best opportunities to reflect and to be brought closer to Allah subhanahu wa ta'ala. So may Allah subhanahu wa ta'ala allow this to be an opportunity to be brought closer to Him, to be brought closer to the ones that we love, and to be brought closer to the Sunnah and the Quran and the mandate that Allah subhanahu wa ta'ala has given to us as Muslims. May Allah protect you, protect your families, protect your loved ones, and allow us to be united in better times. Assalamu alaikum wa rahmatullah.